Welcome back, everyone. You guys are in for a treat today. We are going to be talking with both of our practitioners, Alex Bingham and Kimberly Quirk, and our guest today is Dr. Tom Moorcroft, who specializes in Lyme. So we're going to be talking about chronic Lyme disease and understanding tick-borne illness and how that relates to mast cell activation syndrome. So if you're tuning in with us live, feel free to drop into the comments where you are tuning in from. And if you're catching the replay, feel free to drop that in as well. We are super excited to have you guys all here today. So let's get into it. Just a reminder before we get going, this presentation is for informational and educational purposes. It is not meant to treat, diagnose, cure, or prevent illness, so be sure to discuss any health recommendations with your healthcare provider. And just a reminder that some of the links shared during this presentation or on our website are affiliate links, which means Mast Cell 360 may take a very small commission if you purchase through our links, but we only recommend products that we love or use personally in the Mast Cell 360 clinic. All right, so what are we going to be talking about today? So as I mentioned, we're going to be talking about the overlap between chronic illnesses like Lyme, MCAS, and mold toxicity. So how do those kind of all link together? Why Lyme is often missed or misunderstood in complex chronic illness and how to test for it, and a practical look at healing in layers. So how healing is not just this straightforward. We often have to peel back multiple pieces to kind of find those underlying root cause. And if we have time, we will do a live Q&A if time permits. So please make sure to ask your question only once. That helps us keep track, and keep it on the topic of today's live, as well as no in-depth personal health questions. We appreciate your understanding that we're unable to answer those. All right, so who is our special guest today? Dr. Tom is America's Lyme recovery expert. He's the host of the Lyme Insider podcast. He treats some of the most sensitive patients suffering from chronic Lyme disease, tick-borne co-infections, mold illness, and children with pandas. He's the creator of the Lyme Disease Practitioner Mentorship Program, where he distills over 15 years of experience as a chronic disease recovery expert into a unique approach that allows practitioners to consistently excel at treating patients with complex chronic illness. So I am going to bring our experts up to the stage. Welcome, Alex and Kimberly and Dr. Tom. Thanks for being here with us today.
Thanks for having me.
Yeah. All right. So, let's see, bring our slides down, and we're going to get into some cool conversation. All right. So, Dr. Tom, for those who may not be familiar with your work, can you share a little bit about your journey and how you became focused on Lyme disease and complex chronic illness?
Yeah, sure. You know, like many of us, it's direct experience. I actually love playing outside. Really big about like following your passions. As we were talking before we started, I mean, it's kind of like I live outside as much as possible. And I was in college studying, natural resources, and we were talking about studies and more research. And every time I sat down with the grown-ups, we would just have a conversation about more conversations. We'd have more meetings to schedule another meeting. And I was like, this is not going anywhere. So how about, who could I talk to that would get psyched about taking care of the planet? And I was like, oh, let's go talk to kids and teach them about it. Because if they get excited, they'll get their parents excited, and then we'll actually make some progress. So I went to a place that actually turns out they study Lyme disease and how the habitat and the planet and changes affect, tick populations and such. But I went there for an AmeriCorps, sort of like the domestic Peace Corps scholarship to just, do some volunteer work and help kids learn about the environment. So I was teaching outdoor education. And then, I started to have some joint pain and some muscle aches. And then my boss found me one day staring at a blank computer screen that she had left me at about an hour earlier. She kind of had to shake me by the shoulders and be like, hey, Tom, like, what's going on? Turns out I'm drooling all over myself. I can't remember what's going on. Everything hurt. So sent me to the doctor. Lo and behold, I have Lyme disease. And he's like, hey, classic Lyme disease. Here's your doxycycline. Take it for 10 days. and you'll be good to go. And so I was sick for the first 4 days, laying on the floor with shakes and sweats. And then I got better. But then over the next 8 years, I slowly had symptoms creep in. I was fatigued and my brain fog came back and everything hurt. So I went to the doctor and they're like, well, we don't know what's wrong with you. So you're depressed or you have bipolar and you've got all these other things. And everything, I followed their recommendations, but they never worked. And there was you're not responding like everybody else, And ultimately, 6 years into this journey, I just started doing some yoga, really focusing on breath work. And then eventually, as I did this slowly, my body started to reject all the crappy food I was eating because we didn't know Coca-Cola and pizza weren't food groups at that point in time. And then I started to feel about 70% better, but still 2 years into this. So 8 years now from the tick bite, I ended up in a medical school rotation with a husband and wife team who are actually doing manual medicine, which is what I thought I was going to do, osteopathic manipulation. And they're also treating Lyme. And at the end of the first day, I was crying. I was I can't believe everybody you saw in your office all day, for the first time in 8 years, I've met someone who speaks my language, who actually seems to have what I have. So anyway, I did another 4 years of treatment with them. So it's 6 years of treatment. And at this moment in time, it's been over 13 years since I've had a symptom of Lyme or Babesia. And then the short ending of it is I went into my manual medicine practice and the third person I saw, put my hands on him, I go, oh my God, I know what this is. This is what I had. This does not feel like a normal sort of structural thing. I didn't know who to send her to, so I drew a lab test, supported my diagnosis of Lyme, treated that person, and then treated more and more. And then it's kind of been focusing on Lyme ever since.
Yeah. We were talking before we hopped online that kind of Kimberly came from the Lyme world. Alex was he personally had Lyme last year. I've been treated for Lyme multiple times. It's just if you live in an area with ticks at all, it's almost inevitable, I feel like nowadays.
Yeah.
All right. So most people with complex chronic illnesses have been told you're fine, even when you knew something deeper was going on. So can you talk a little bit about why these conditions often go unrecognized? Like you said, you finally got, after some treatment, you finally went to that husband-wife team and you're they're speaking my language. So why does it take so long for these to be recognized?
Yeah, I think there's several factors. One of them is, at least back when I first got sick, people just didn't really even know. I mean, he nailed Lyme disease because of a rash and symptoms, but he never thought about Babesia. But the symptoms of my die-off, with that, they put me on the doxy. The symptoms that got the worst weren't really Lyme symptoms. They were more babesiosis symptoms. At least that's what I learned, after the fact. And I think that people just have been taught that Lyme's really hard to get, really easy to treat, and the research doesn't support that. So our typical medical knowledge from when it first came out needs to be updated. And I think that's a big one. People just don't know, and they're being spoon-fed certain information that needs to be updated. And the beauty is the people that previously were telling us that it's hard to get, easy to treat, are now actually coming around and looking at the research going, oh, what I said before wasn't quite right. It's only taken 2 or 3 decades to get there, but we're actually seeing that momentum. I think the other part too is, when you see somebody with a complex of symptoms, back in the day, we always said syphilis was the great imitator. And then when that got, treated well with penicillin, they're oh, the next spirochete illness, Lyme disease, is the next great imitator. The problem is it looks like so many other things. I mean, how many people come in to see a physician who have brain fog, fatigue, and joint pain? So unless it was right after a tick bite with a rash, it's just the symptoms require them to take more time than most people have. I know everyone here spends time speaking with the people that they're working with. My initial consults are an hour and a half for a reason. It's because what I did was, in my residency, I was trying to figure out why I was doing my 3rd year exit sort of appointment with people, and I was making all these breakthroughs. And I'm like, okay, wait, it took me 3 years to have a breakthrough with you where we had such a good relationship that you could actually tell me what was really going on. So I went back and I said, what is the average amount of time I spent with this person over 3 years? And it was 80 to 90 minutes. So I decided my new patient visit would be 80 to 90 minutes so I could get it done with. But insurance doesn't like that because, there's a lot of people who are sick. So I think part of it is we need time to sift through generalized symptoms. And that's really a big deal. And then the other part is, the CDC always says like 80% of people with Lyme are going to get better with 10, 14, or 21 days of an antibiotic. And then they're silent on the other 20%. And so what we see in the research is, there was an article a year and a half ago that came out in Pediatrics, like showing that 75% of kids will get better within 6 months. And I go, okay, but what about the other 25%? And they actually said, oh, these kids are actually still having symptoms, that some of which, 9% of which are still disabling after 6 months. And so what's really interesting is we started to see people research and say, most people, 75 to 80%, actually do get better. The problem is all of us tend to see the people who are in the 20% that don't get better. And then when you take it one step further, there's some research out of Johns Hopkins, right? Not out of my basement or out of somebody's community college, but Johns Hopkins, where they said, hey, if you infect a mouse artificially, well, let me step back. If you infect the tick artificially and then you let the tick feed on the mouse, approximately 80% of those mice that get late Lyme disease will get it the normal way, which is we don't treat them, we let them be sick for 6 or 12 months. But the other, so that's like normal, right? That's what I learned in school. You get late Lyme if you miss it. But they found about 20% of the mice had persister forms of Lyme disease, the cyst form, round bodies, like biofilm, microcolonies, all these things that people are hearing are buzzwords. They're getting that at the time of tick bite. And what they found was the Borrelia, which is the Borrelia burgdorferi, is the bacteria that causes Lyme, that's in the tick, can actually go into persister forms in the tick, and then you can get inoculated. And what was really interesting to me is they still need more studies, but about 20% of the mice were getting chronic Lyme right away. And about 20% of people don't get better right away. And so you start to go, oh, maybe all these warring sides, the feuding different sides actually have a part of the truth. And maybe they each have accurate information. So what we're seeing nowadays in groups like Global Lyme Alliance and other people are doing, bringing clinicians and researchers together along with the work of ILADS, is that everybody's starting to say, hey, we all have a piece of the bigger picture. And when we actually come together, we can do this crazy ass thing, which is put the patients back at the focal point rather than I got 10 minutes, I got 5 minutes, or I don't know what's wrong with you and it's going to take me too long. So now you're a psych case, which is what happened with me. Until we treated it. It's amazing how depression and anxiety things go away with antibiotics sometimes.
Yeah, so I think you kind of started to answer the question between the difference of acute Lyme and chronic Lyme. So especially in terms of how symptoms present, can you explain the difference a little bit more and like why the chronic Lyme is harder to catch? And how do we test the people to know like what we're dealing with?
Yeah, I mean, I think one of the big things is chronic Lyme is you either got a tick bite and you missed it. Now, a lot of people are like, well, how could you miss a tick bite? Well, if you look at about 95% of the people who get Lyme disease get it from the bite of an infected nymph tick. And for anyone who doesn't know, the nymph is about the size of a poppy seed. So good luck trying to find that in like between your toes, behind your knee, in your groin, in your hair. So it's a lot of times we're missing, because I just had someone this morning say, hey, I got bit yesterday by a deer tick. And I was like, oh, can you show it to me? They're like, oh, here it was. But it was this big, bright red, orangish female with a little black spot on her back. But it was easy to find because that's the bigger one. She only gives us about 5% of people Lyme. So the first part is whether it's chronic or acute, sometimes it's just hard to even know you were exposed. And then the next part, I think, really becomes chronic Lyme is like you get a lot of times like when you look at late Lyme disease, which is what people talk about in the literature, that is when you get infected, but you don't have symptoms start for 4, 6, 8 months. And they're like, oh, it's always like Lyme carditis or like really bad arthritis. The reality is sometimes you get these persister forms and they're just smoldering. So they're just slowly growing. I mean, Lyme reproduces at least, in test tubes on average every 3 weeks, whereas like strep throat reproduces 13,000 times in a day. So we're talking completely different rates of reproduction. So if you don't get a big inoculation, it seems like some people just have this smoldering, slow growing infection that all of a sudden presents in February. And then people are like, well, Lyme doesn't happen in February. I'm like, well, one, it can, but oftentimes in the Northeast, you're not getting bit in February, but you got bit in September, October, and it shows up in February. So then someone misses it. And it's not because they're doing something wrong and they just think it's a virus or something. And then, I remember in residency really clearly seeing all these people come in with like acute fibromyalgia. I'm like, wasn't fibromyalgia something you have to have for 6 months and no explanation of symptoms? It doesn't just boom, come on. So, I think it's just confusing to people and its presentation is often insidious. So when I first got Lyme disease, I was diagnosed relatively quickly and treated appropriately for what was known at the time, with the exception of they never looked for co-infections, which is probably why I was sick for the next 8 years. But if they had just extended that to 4 or 6 weeks of treatment and followed up and asked me about my Babesia symptoms, then maybe I would have had a different course. But a lot of people aren't lucky with a rash. They don't have a big swollen knee. And so it's just when you have fatigue and brain fog coming in, I think that's the biggest challenge. And once you've had it for a while, and I mean, I'm sure all of you guys who have had it know, and even like the mast cell group, it looks like everything. And no matter what you do, you're like, oh my God, like, how do I even put my finger in the dam to prevent it from breaking? There's so many weird symptoms happening. People almost don't even know where to start. And so sometimes it's even hard to come up with what is the cause. That's where chronic Lyme looks like everything. It looks like MS. It looks like neuropathy. It can look like migraine. It can look like cardiovascular issues. You can have bone issues. So, it's just across the board when you have these non-specific multi-system symptoms, it just gets more confusing.
Yeah.
Tom, can I just ask a question? When you get a bite and you get Lyme disease and you don't get any symptoms right away, or you get some symptoms, but sometimes they just go away and you thought you had the flu, how long do you have to treat that before it actually becomes a chronic thing? Is there a 6-month window? Is there a 3-month window?
That's an amazing question, Alex. We don't know the answer. I think the best we know is that the sooner you treat people aggressively, the better their likelihood of a positive outcome is. And I always say, look, my niece was on minocycline 100 milligrams twice a day, which would be a Lyme treatment dose for over 5 years for acne. When she finally took a probiotic like we recommended, that's all we asked her to do. We didn't get into all the stuff because I knew she wouldn't do it. Her acne went away and they stopped the minnow. But if I gave you minocycline for 6 weeks for Lyme disease, they'd think I'm a heretic, right? So, but I do think the longer initial treatment is important. So what we do know is if you're a mouse and we inject you with Lyme disease, and we treat you for 19 days with a long-acting doxycycline, and you have Lyme disease or anaplasmosis, which is another infection you can get from the same tick, or you get both of them, we can prevent you from getting those infections 100% of the time. We also know, and then all of our studies in between there and 4 months were clueless. We do know, depending upon which monkey study you look at, if you infect a monkey for 4 or 6 months, and then we treat you with IV ceftriaxone for a month, and then we give you 2 months of doxycycline, we cure a whopping 27%. So if you take the original study there at 6 months, we know that somewhere between 0 and 6 months is where it gets bad. We don't know which one it is. And then going back to the other mouse study, some people probably get chronic Lyme that they need, 4 or 6 months of treatment right away at tick bite. The vast majority of people, it's probably the undertreatment or the missing diagnosis that's left them 4, 6, 8 months without diagnosis and proper treatment, which is the thing that then leads them to the chronic state. So I think in my experience, if we can get you in the first 4 to 6 weeks, it really feels, and you're seeing someone like you or I who would extend the treatment out till they're asymptomatic and then a little bit further, and also work on all the other things I know you guys work with all your clients and patients with, then you have a better chance. But the sooner the better. The longer the initial treatment, likely the better. I think a lot of experts have really said in the initial phase, if you get it acutely, if you're going to do 3 weeks, do 6 weeks. Monitor closely, make sure you're not having side effects. But again, we don't know the answer to your question. That's just the best science we have at the moment. So yeah, anything after 3 months, I'm kind of like, eh.
One of the things that seems really amazing, but I don't think that people really take advantage of it, is that it's very hard to diagnose it with a lab test necessarily in the beginning, but you can send the tick away. And I don't know how many people I hear the ER picks out the tick and they throw it away. And, then you're not sure exactly what to do. If the tick comes back with an infection, what's the likelihood, let's say it was in for a day or two, what's the likelihood that it's been transmitted?
Yeah, another awesome question. I mean, we have some decent evidence. It's a little old, but typically if a nymph is going to feed for approximately 4 to 5 days, so in the first 24 hours, transmission rates are published at about 5%. Clinically, it looks like it might be a little more than that. And then day 2, it gets worse. And day 3 and the 4, it's like, you're approaching 90% if it's fully fed. So the less time it's on you, the better. Now, there's this thing out there, it has to be attached for 24 to 36 hours before it transmits. That's actually not true. We've documented near instantaneous transmission of Lyme disease. We've found it in the salivary glands. But the truth, this is where I go back to, there's these 2 original camps from back in the day that are starting to actually talk a little more. Most people need that tick to be on for probably 2.5 to 4 days before they get Lyme. But I'm not seeing most people. I'm seeing that smaller percentage of people who get it in the first day that someone goes, oh, you're okay. And here's another one that kills me. So I want everyone to pay attention to this. If you have a Lyme rash, you have Lyme. If they get if you have a rash and they put you on doxycycline or some other medicine or some herbs or whatever, and 2 days later they say your ELISA screening test for Lyme is negative, and they say stop the medicine, go see another doctor, because they don't know anything about Lyme or testing. Because if you have the rash and it's in the first week or 2, you may not have had enough time to make an antibody response that would be picked up. They have died. If you live in a Lyme endemic area, which not all the country is, but most of it is at this point, and you have a bullseye erythema migrans rash, and the other thing is, it's so funny, I even slip into this, that bullseye ringed rash is about 30% of all rashes that are truly a Lyme rash. It's usually a red or purple splotch. So, but if they diagnose you with Lyme and then the test comes back negative, that doesn't necessarily mean anything. And the 1-day prophylaxis, like the 200 milligrams of doxycycline, go read the study. It basically says it can prevent the rash, and the rash is being used as a surrogate for infection. And when you take it, we can actually have people who now have blood test negative Lyme disease that you have a really hard time finding. So I don't prophylax for it with 1 dose of anything because there's no good science behind it. Yeah, it's just, as you can tell, I get all frustrated because it's better. I think the point that you're reminding me of, Alex, is early diagnosis, early treatment is really critical in this. And, it's just important. And if you do send the tick off, don't start having the conversation, oh, the lab is wrong. I mean, they have the entire tick, and unless the genome is wrong or the machine broke and no one told anybody, they know what they have, right? And if they have it, they will tell you about how long it's fed. Now, again, it doesn't guarantee one or the other, but the longer it's fed, like when they say like fully engorged or partially fed, I mean, they're a little bit different. So the risk goes up the longer it's been feeding.
Yeah. So Karen's asking kind of what Alex had brought up. Are Lyme tests reliable? How are practitioners testing to see if you have acute versus chronic Lyme?
There's, depending upon when they're ordered and where they're ordered and who is interpreting them, they can be reliable-ish. In the first 4 to 6 weeks, you like that ish. In the first 4 to 6 weeks, you may not make an antibody response. After an acute tick bite, this is where DNA testing at Quest or LabCorp, one of those commercial labs that you have locally through the hospital, actually can be really good because we're before they start the antibiotic. But if you're not sure, that's where DNA of the organism floating through your blood is really helpful. Long-term DNA is really hard because you're looking for an organism that loves tissue. Lyme disease, even babesiosis goes through the blood, but it's been found to hide places. So if we're looking for Lyme with DNA 4, 6, 8 months later, if you've never been treated, it might help. But at the same time, it's already in the tissue. So it's probably not the best test. And then, in that 6 to 8 or 9 week window, we're really looking at antibodies can be helpful. A couple things about antibodies. One is the longer you have Lyme or other things that are like Lyme, the more likely you are to have a functional immune suppression, which we're trying to have your immune system make an antibody to say you've seen Lyme. So a lot of times it's not always the best. And then the other thing is you have to make sure that this person doesn't have an immune deficiency. We're using these immune system markers, and a lot of people don't even test for that. So it can be challenging. Now, we also have the whole thing between conventional labs and specialty labs. And people are always like, well, why is there a difference? Well, most of the conventional labs are using a laboratory strain of Lyme as a surrogate for all strains of Lyme in the country. And what we're finding is if we use multiple strains or more wild type strains, you get better results. And also some of the old school technologies just aren't as high fidelity as some of the specialty labs. So some of the specialty labs out there have really done significant upgrades in the ability to pick up antibodies. And one in particular, the other thing is we have criteria that were from this Tick-Borne conference in 1996. And they were taking out things that were important, putting in things that weren't important. And so what we saw was at the end of last year, one of our major specialty labs got FDA cleared, which is what the approval process for labs is called. And they were actually able to get the FDA to say that not only usually we go for medicine and labs for non-inferiority. So the FDA will let you put out a new medicine as long as it's no worse than any other medicine out there. It doesn't have to help anybody more. It just can't hurt them anymore or perform less. So same thing with labs. But what we found was we had not only non-inferiority, but we found superiority with using more Lyme-specific bands so that then the CDC changed their diagnostic criteria at the end of 2024 that had been in place since 1996 because of the specialty lab doing the right science and finding out that they were so accurate. And then, so we're getting better, right? Then the other thing is we also have advancements in direct detection, which is like the DNA, PCR, or we look at RNA. So we're essentially looking for the genetics of the organism, and we do have some cultures available. So even through the pandemic, some of our DNA technology had to get really fast-tracked to be, we needed clinical innovation, and they did that. So now they're bringing that into Lyme, Babesia, Bartonella, and it's been very helpful. The biggest challenge is indirect measures, which are the antibodies, or even if you've heard of T cells, are looking at your immune system's impact. So we can't do it right away, but it's better early on, and it's our best test overall to show whether or not you've been exposed, but it never really 100% says it's an active infection. Then the direct measures, RNA, DNA, culture, are notoriously inaccurate when they're negative, and when they're positive, they're almost 100%. So you have to work with somebody who understands the nuances of them. But usually where I start, and I'll finish here, is when I trained with Charles Ray Jones, he said this, and I went and I looked in Harrison's textbook of internal medicine. It's like 3 times as thick as the Bible. So it's like, it is the Bible of medicine. And it says Lyme disease is a clinical diagnosis that's supported by lab data. It is not a diagnosis made by labs. So you have to go see somebody who knows what they're doing, and they have to have the cojones to say, yes, you actually have Lyme disease.
So you had mentioned earlier there was a test. I'm just going to throw this up here for Joe real quick before the context is gone. So what DNA test were you talking about getting from Quest at the beginning? You said there was a test like in those early weeks.
Yeah. Well, there's multiple different kind of ticks you can get bitten by, but in the United States, only Ixodes ticks, so the black-legged or deer tick on the East Coast and the Western black-legged tick on the West Coast, are known to transmit Lyme disease or the bacterium Borrelia burgdorferi and its cousins. And so if you're bitten by a deer tick, we can look for Lyme disease, babesiosis, anaplasmosis, and Borrelia miyamotoi, which is a type of tick-borne relapsing fever, and they can be done at Quest or LabCorp or whatever. If you get bitten by, say, like a dog tick, then you're looking more at Rocky Mountain spotted fever, and if you get a Lone Star tick, it's more Ehrlichia. So you can get the pathogen-specific DNA testing.
Thanks. Gladys on YouTube is asking, is Lyme always from a tick bite, or can it be from other things?
The vast majority of Lyme is from a tick bite. We do know there's confirmation of transplacental transmission, meaning mom to unborn baby. And then we have some evidence of spirochetes that cause Lyme, Borrelia burgdorferi, being found in breast milk, but no confirmation of breast milk transmission, which makes sense. But you got to follow the science, and there's no evidence of that. And then there is a big question about sexual transmission. Some researchers have tried very hard to make it an STD. They have not been able to. There's one couple in the history of us studying this that may have had the same strain. And they were saying that that's like the big evidence. People are definitely looking at that. There is no evidence of blood supply or blood transfusion associated Lyme disease, but other deer tick pathogens, Anaplasma and Babesia, have been reported. Now, Babesia has been reported the most. It is a bloodborne pathogen. I mean, it lives in red blood cells, so it makes more sense. But there's only about 230 or 40 confirmed cases, so it's not a big problem, and they do screen for it. But like for me, I'm not allowed to, or I was not allowed to give blood because I had a babesiosis, which was kind of interesting. I can't give blood for life, but you treat it with 7 to 4 to 10 days of an antibiotic and an antiparasitic. So you're like, what do they know that they're not telling us? And ultimately, more recently, they've been, if it's been at least 2 to 3 years and then you have blood test negative, they're letting you give blood. But so that's kind of like where we're at now. And usually what I do when I say something like there's no sexual transmission confirmed, people get all mad at you like you're lying. The point is, the science doesn't support it, and we have really good science, but that doesn't mean it never happens. It just probably doesn't happen as often as some people would say it does. There's I've seen videos on people saying mosquitoes transmit it. That we have no evidence of that. We know that it's been found in the mosquito midgut. It can live up to 5 hours, but the mosquito has no way of actually transmitting it to you. There was one other, and I saw something pop up in the chat that distracted me. But there was one. 1996 was like a year. It's either 96 or 98. There's one case report of a black fly maybe transmitting Lyme in the history of the world. So that's probably not a big thing that happens, but it's out there. So the weird stuff happens, but tick bites are most of it.
Yeah. Thanks.
One thing, and Jamie, I apologize for just jumping in, but one of the things that we see is we don't really see very many people come in with primary Lyme disease. We see people at mast cell 360. They come in with mast cell activation, a lot of mold toxicity, and they might have Lyme disease at the same time. They might have other things, SIBO, just a plethora of different problems. And so one of the problems that I had initially when mold kind of, and I think that's where I met you, Tom, was at that Richie Shoemaker, where we came to Boston and sat with us for 2 days. But how do you kind of like put it together when you've got these multiple things? You got Lyme, you got mold, you got mast cell, and how are you going to go about figuring out where you're going to start?
Yeah, I think this is one of the biggest challenges we run into. I think the most important thing is first week of medical school, they said, hey, if you don't interrupt your patient for 5 minutes, which is a big if, because statistically doctors interrupt their patient on their first visit within 8 seconds. So, but they're like, listen to your patient for 5 minutes. 95% of the time, they're going to tell you what's wrong with them and how to fix them. I was like, wow, my job's easy. Shut up for 5 minutes. As you can tell, it might be hard, but I've gotten there. I think the number one thing is the history. And part of that history is, I always say, are these symptoms compatible with tick-borne illness? Are these compatible with other vector-borne illnesses, such as like Bartonella? Are they compatible with mold illness or mast cell activation? If it's mast cell activation, I'm always like, why? You're telling me how the body's reacting to something, but you're not telling me what the driver is. So I'm always asking why. And then I go, hey, there's this crazy ass thing called a timeline. So what happened in your life? When did it happen? Like, I've seen a lot of kids like, hey, they got Lyme over the summer. They weren't too bad. They were sort of getting better. And then they got strep, and then they got pandas. So I think a lot of it has to do with the old school, clinical picture and the timeline of it coming in, because as we all know, mast cell activation can be triggered by Lyme, Babesia, Bartonella, from mold toxicity, from SIBO, and they're so intertwined. I remember when I started, there's like a little Venn diagram or whatever they were doing, and there's Lyme's over here, and Babesia's over here, and Bartonella's over there, and there's a little overlap between Lyme and Bartonella, say, a little overlap between Lyme and Babesia, and then if you meet all three in the middle, then that's really tough, but you don't see that often. Look for the pattern. Now I'm like, it's just a big gray shmoo in the middle. It's so complicated. So I really think this is where that relationship with your patient comes in. And then at some point, I coined this term a long time ago, but I play Lyme chess. And really, I kind of mean more like chronic illness chess. I do the best I can. I ask my patient to tell me what they think's going on, and I understand that they have a bias. I also understand that I have a bias. So, but let's put it all together. And then I'm going to do this crazy thing like move a pawn. I'm just going to say my best guess is step one is this, and I'm going to do it. But when I take that step, I'm looking to see what the response is in return. So, and it makes sense, but it's like there's this whole thing about like we assess our patient and then we reassess them on a regular basis to know what goes on, and we build a timeline of treatment response. And so I'll move my pawn playing Lyme chess, and if I'm like saying, hey, I really think Lyme is the thing, and I start herbs and maybe a medicine that do that, but then it starts to look more like mold or whatever, or I don't see a reaction, I put all the data I get together in one place and I start to ferret it out. One thing I will say is if you go to a mast cell specialist, they're often going to start at a mast cell. If you start with a Lyme specialist, they're often going to diagnose you with Lyme and start there. And if you go to a mold specialist, they're going to start there. So I have some really great friends. I'm sure you guys all know them, but it's like, they're like, you got to start with the mold. Unless they have mast cell, then you got to start with mast cell. And I'm like, okay, but what if all of that's being driven by untreated Bartonella? Right. So I've seen just as many people where I need to start with mold. I should have started with Lyme or Bartonella or whatever. So part of it is working with someone who's willing to take the time to have this conversation, be comfortable with, I'm pretty sure the order is 1, 2, 3, but it actually might be 2, 7, 10, 1, 4, 3, and we don't know until we start. So that's where it's that partnership that I think is so important, because the second I tell you to start with Lyme, I lied. Unless I didn't, right? Because everybody's different. And, I just remember a conversation with our mast cell summit back with Beth and I were talking about this, is like, I love the thing is like the mast cells are the sentinels, and they're like hyperactive. They're always on guard. They never get a break. There's nobody from the barracks coming out and saying, okay, you can take a nap. It's my turn. They're on 24/7 and they're freaking out. I'm like, why are they freaking out? And sometimes the answer is, I need to just calm them down. I need to calm the immune hyperreactivity down and the inflammation before I can even technically treat anything. And the other thing that just jumps to mind is, one of the things, and I'm sure we'll probably come to this, but I'll just throw it out there because it's on the top of my mind, is so much of this is addressing this, how the immune system and the central nervous system is reacting. And both of them are reacting to the threat, not who is the threat. So a lot of times we start off going, I need to know the answer. I go, you don't. That's my job. What you need to do is tell me what's going on and start taking action each and every day that you can take so you gain the momentum in healing. So I think from a practitioner perspective, we need to know the answers to how to start to play the Rubik's Cube. I should make a video about this. I say this but I finally figured out how to do a Rubik's Cube because a buddy of mine's kid showed me a video where if you follow the guy perfectly for 10 minutes, you'll solve it. And I did it 3 or 4 times and screwed it up, even though I was following him. I was like, how did I mess that up? But what I learned was a lot of times you're doing the right move, but you might have just done it 2 turns too soon. And so you just have to back off, turn it back, and then reset, and you're good. And so I always tell people to crawl before you walk, walk before you run. And if you make a mistake, just take a step or 2 back.
Mm-hmm. Yeah. Kimberly, you're like the queen of like stabilization, I feel like. Do you kind of what Dr. Tom was talking about is kind of like, I think a lot of people are like, where do I begin? How do I decide where to begin? Do you have any advice for our?
Yeah, I mean, I really love what you said about who is this person, right? Mm-hmm. What has been their timeline? What are the symptoms? And and moving that one piece, baby step forward. I do think it's really looking holistically at, the nervous system, the history piece, doing some testing. I like to start with a little bit of mold testing, just because it's easier to test than like say Lyme, right? More reliable, very common, especially in the mast cell clients. I know we find it to be about 95% of people with mast cell have at least some mold, and it could be from the past. So looking at the environment and doing all that lifestyle stuff, including the nervous system, to kind of start on that healing path, the diet, all those things. I would love to know from you, I think I've answered probably for friends and friends of friends in the past week about a new tick bite. What is the proper protocol to move forward? I would love to hear from you, because I think that's a really helpful tool for people.
It depends on who you talk to. I think if you're talking to a conventional doctor and they offer you doxycycline 200 milligrams once, just politely decline and watch and wait, or call one of us who can help. But typically, if it was a deer tick bite, I would give someone prophylactic treatment with an antibiotic, say doxycycline or minocycline, for 3 to 4 weeks. I typically will also include botanicals like cryptolepis and Chinese skullcap, because if you happen to get persister forms, most of our antibiotics suck at treating them. And hey, if about 20% of people could get that and the herbs have a really low side effect profile, I'd rather just also get them started on that. And then if they develop any symptoms while I'm treating them, then I know they're infected, and that's a whole different story. You don't have to preventively treat people. And I've also had patients where they'll do like I have tick bite bundles and stuff that we have on our store, because it's like we'll do Japanese knotweed, Chinese skullcap, cryptolepis, plus or minus cat's claw. Cat's claw is really good to put in early. But these are all evidence-based botanicals that have been studied against Lyme, Babesia, Bartonella. And why not put them on early if you could? Because they have great, like I said, they have great fringe benefits, anti-inflammatory, protect all your organs between the 3 and 4 of those. So that's kind of typically what I would do. Some people will like to just send the tick off and wait. We would prefer to get results within 4 to 5 days from the time of tick bite, so that, that's kind of our window for the best likelihood of actually preventing infection. So we usually call it 5 days, but, and some people I'll start on medicines and then they get a negative, their tick comes back in like 4 days and it's negative. And they're like, what do I do now? I'm like, with antibiotics, I typically would say, depending upon which one I'm using, but I'd continue it for 7 to 10 days, not because I think they have Lyme anymore, because I've shown from the tick being tested, they don't, or that if they do, it's not from that tick bite. Is that I now have introduced changes in your gut, changes maybe in your lungs or your nose, and I don't want to give you, I don't want to create resistance. And since most of the common pathogens that we might mess up with that are treated in 7 to 10 days, I usually just call it that. And that's how we go about it. Oh, and I guess I would say one other thing is I have had patients when it's their preferred approach, just do botanicals, and I've not seen that fail before. So I've seen that be very effective as well.
What about putting Estragalus with clay on the bite itself? Do you think there's any evidence that that can be helpful?
I haven't seen any evidence that it is. There was a study for where they had did that with azithromycin topically, and I think it worked locally. But I mean, again, the question is, what are we getting at? I mean, I don't know that Estragalus kills Lyme. I would rather to be honest, Alex, if I was to do it, I'd probably put Cryptolepis on the bite. And there's zero science behind doing that. But I know that Cryptolepis kills all the things we've been talking about. And with the exception of being tied in Babesia with Chinese skullcap, it's the most active against Lyme. So I might do that. But again, if you're doing it for the local skin reaction, to calm down the nervous system and the immune system at the bite site, I don't see any wrong with it. And anytime you inject something into the body, if you can suck it out with some clay, hey, again, I always think, what's the risk of doing that? And the risk of doing that is pretty low. In fact, you could do Cryptolepis, Estragalus, and clay, probably no risk at all, unless somebody has an allergy to those things. But yeah, I mean, but as far as the evidence behind it, there's not a lot of people who have studied it. But I think it'd be really interesting to do.
Alex or Kimberly, do you have any other questions?
Yeah, I mean, I've got a lot of questions, but I'm thinking that one of the things that I found, just my daughter's case, I mean, she was, I don't know, 10 years ago or so, she was a healthy kid. Senior in college, and she got mono, and she just bottomed out and moved home. She was in bed. Weeks later, months later, she's still getting sick all the time, fevers and all this stuff. So we found that she did have Lyme. She had Babesia and Bartonella. Started really aggressive treatment. 2 months later, she'd no better. Maybe 6 weeks later, tested her for mold. It was sky high, and stopped all the treatment for a year and a half. Treated her with mold, and she hasn't had any treatment ever since. Now, the way I put it together was that, we're hardwired to be healthy, but there are thresholds that we cross where we need some kind of active intervention. So I think she had the Lyme, she had the mold, and it was the mono that pushed her over, but it was the mold that kept her there. And
Yep.
So I like what you're saying about having to figure that out, but I agree with Kimberly that a lot of times I find that the mold is just so suppressive of the immune system that I have to deal with that to some degree right away.
Yeah, I mean, I think especially if you're looking at mycophenolic acid, or at least species that do that. I mean, that's been synthesized into a organ transplant anti-rejection medication. I mean, these things mold can be profoundly suppressive to the system. And the other thing though is I love what you're saying. I view it like this, right? I mean, you're a vessel that can handle so much toxicity. And if your toxin level's here and then you get there, you kind of got acute illness, you'll probably get better. But if you're floating up here and then you get this and you're overflowing, now it all looks the same. What do I treat with? I don't know, because you're reacting to everything. That's where I have to take it slow and steady. And then it's also there are a lot of stories I hear, like you just said about your daughter, who the next step is they do the mold, and the mold treatment doesn't really work. And then it's then we're everybody's talking, I got to do limbic system and all this other stuff. And, one of the things I learned through my own journey, which, was on the neighborhood of 12 and a half years from start to finish, and then doing this kind of work exclusively for the past 15 plus years, is that the people, who heal aren't really the ones who chase every protocol. They're not the ones who treat everything. They're not the ones who, go to you guys and go to Mast-Cell 360 and get a protocol. And then they also go and they go to a Facebook group and then change it or whatever. but they're really the ones who step back. They partner with a provider who can support them along their way. And then they're also the ones that change the way they think, the way they live, the way they love. I think a lot of times what I learned was through this whole thing was I was 75% better before I got a diagnosis because my back was against the wall. I remember it really clearly. I'm staring at the wall in my apartment and I go, I'm going down that road and I hate it. It sucks. Every morning I wake up and I just play that role and I just don't want that life. I want to, I was recently married. We're considering a family. I love playing outside. I wanted to get back to ultimate Frisbee and skiing and riding. I wanted to play outside with the dogs. And I was just saying, like, I know what I want to do, but I'm getting something else. And I woke up every morning going, I feel like shit. This is like my bad day. And I go, oh no, I actually want this. So I had no idea what I wanted, I had no idea how I was going to get what I wanted, but I was clear on what I wanted. So I decided to just pretend I was going down that path. Like within days, somebody handed me a yoga DVD. The DVD was this guy who's bringing power yoga into the country rather than doing the traditional. And he had the breathing all messed up. I tried to do it. I was like, first of all, I can't move my body. It hurts. And second of all, the breathing feels wrong. So the first lesson I learned was decide what I want, because if I focus on what I don't want, I'm already got that. So I don't want to get more of it. Let's decide what I want my life to look like. And then I said, like, hey, pay attention to what it feels like as objectively as possible inside. I tried to do this yoga. It hurt, yes, but the breathing wasn't right. But there was something to it. So I go to the back. I find out where he studied. I went and I found who studied with the true master from India, the guru, and who actually taught it the original way. So I learned Ashtanga yoga. Is a 90-minute practice. And they said, it's breath, it's movement on breath. If you can't breathe fully and deeply, you're doing it too hard. So I learned again, I have a litmus test for when I'm pushing too hard. I get contracted. If I feel open and expansive, whether it's your breath and or your energy field or your love field, your gratitude, whatever that is for you, that's your internal barometer. And so I had a 90-minute practice. They said, you practice the physical posture as long as you can, and then you just breathe. So literally, like, I couldn't even touch my kneecaps while I was standing up. I had to sit down to do that. So you can imagine how power yoga was for me. I would try to do a sun salutation for about 90 seconds. And then I had to sit for 88 and a half minutes breathing. But I said, I don't know how I'm getting there, but I'm getting there, so I'm doing it. And I doubled down on what I had control over, and I stopped focusing on what I didn't, because healing's not just about killing the pathogens. It's about creating momentum where I can. So years and years later, like, I got very flexible. I felt good. I healed myself mostly. And then I still needed the doctors. But what I learned was that breath was being primary, helped move the lymphatics in my body. It helped literally detoxify me. Because of what we know about breathing now, I knew that it was calming. I could feel it, but now I know as a physician that this is calming my nervous system down. It's improving my heart rate variability, which means now my immune system is being supported, and I'm bringing down my sympathetic tone and becoming parasympathetic, which means I can sleep. The more I can sleep, the better my brain detoxification system works. So everybody's like, what's the best detox protocol? I'm like, breathing, water, and sleep. Move your body if you can. But seriously, it's not that hard. And everybody's going for these big protocols. This is what Beth said so eloquently. Start with the nervous system regulation. Breathing is free. In fact, breathing is actually costs you money not to do properly because you're already doing it. Sit down, focus on your breathing, let it bring you down. There's all kinds of other techniques and programs and things to do. But sometimes the KISS program, the KISS principle, keep it simple, stupid, really helps, because when you create the momentum, one of the things that I find that chronic illness patients don't do is they give their control away to other people. I need a protocol. I need a program. I need a botanical. I need a diet. I need to go ask somebody else if I'm doing the right thing, because even though it feels right, I'm afraid. All of these are good supports, but it's like when you start to realize that you can literally boost your immune system and decrease brain detoxification or decrease toxicity levels and improve brain detox and body-wide detoxification by simply being present in your body, you create a momentum and you build resilience not only just in your physical body, but in your mental, emotional, spiritual body. No one can do that for you. No one can take a pill for you, but that's like kind of easy. But, you know, it's like really doing those little things each and every day where you say yes to yourself. Because if you say healing is always outside of me, you're telling your body and the universe or God, whatever you believe in, you're telling the life force that lives and breathes you that you're not worthy to receive healing, that you're not good enough. And really, the thing I learned through my journey, no idea what the hell I was doing. I got lucky. Or the coincidence was I doubled down on life and living my dreams and my passions, even when I didn't know how. And then God brought this and put this in front of me and said, now, Tom, you have to take action. If you really believe you deserve that, then you need to take action and prove it to me. And all these people tell me, oh, like I did this and it didn't work. I go, well, how much did you do? Well, I did like 5 minutes of breathing for 6 days. I'm like, okay, and then what happened? Well, I felt a little better, but I wasn't cured. I go, so if the universe or God gives you 2% improvement and you say, F you, that's not enough, do you think it's going to trust you with more? If you want to be 70% better, you got to put 70% better effort into it, right? And I don't mean like physical effort, and we can't cure everybody. I don't walk around pretending I have a magic wand or I'm God. But what I mean is, you are so worthy. And I differentiate cure and healing, Alex, and everyone. It's like, I've seen so many people cured of their illness. I get rid of the Lyme. You get rid of their cancer. You fix the problem with the surgery, and they're miserable. And everybody around them, their lives suck. I've also seen people where you mostly fix their Lyme or you partially fix their cancer, and they end up maybe with cancer. We've heard this a lot. Maybe they die. But we allow them to be complete within themselves, within their family, within their community, and they feel whole again. That to me is healing. And the most people I've seen cured are also first healed. But just because you're healed doesn't mean you'll be cured, but it doesn't matter anymore because you're living your fullest life with what you have. And to me, that's the key to healing, is not necessarily like we could talk all day about the protocols, and they're necessary. I still needed 4 years of the 30% to get better. But I would have not have even been able to receive the healing if I didn't first say I was worthy and then take the steps myself. So my recommendation to people is do everything you can from where you're at with what you have, right? So it doesn't mean you follow my protocol. You work with someone to figure out what your body, mind, spirit, protocol is. But it starts to me with one big word called love. And it's easy to love other people around us, sort of. My challenge to everybody would be to go stand in front of the mirror and say, Tom, I love you. Alex, I love you. And where the spot where that bugs you, just be aware of it. And that's all you need to do. And then maybe breathe for a minute or two into it, and then work with amazing people like you guys who know how to take it to the next level. But if you can't love yourself, you're not going to heal. You're not to the fullest, and you're not going to be able to love the people around you. And to me, that's the most important part for healing.
Yeah.
And I'd love to echo that. I was just going to say that the clients that I see get better are the ones who are showing up for themselves continuously, even when you get knocked down.
Yeah. You're so worthy. It's like that Marian Williamson quote that I should put the whole thing to heart. But because if you read the whole quote, it's incredible. But the short version is, it's our light, not our darkness, that we fear the most. And she goes on to just rip into it. It's amazing. But so definitely check that out, everybody, because it's just like the reason I got into all this is I'm an osteopath, and I learned that the body has the ability to heal itself. It has a self-healing, self-regulatory mechanism. So our goal is to catalyze healing with our binders, with our charcoals, with our mold protocol, with our antibiotic or our herbs, not to do the healing. Our job is to unburden your body and catalyze it just enough to do it on its own, and then take our stuff away. So every time we put it outside and we say we need something more that's not us, we tell our body to function in a way that it's not designed to work.
I'm ready to go.
Yeah. Melissa says she loves this, and we have another, I agree. We have to take back our agency to find liberation in the body again. Great comments.
And everybody, and I just want to be clear. It's like this. Some people, this is what we just talked about is that much for you. But for most people who are chronically sick, it's like a huge amount. And I'm not saying you don't need all of it. I'm just saying that there's like, if you just take the, like 100% is the line across the top and you have a bar graph with body, mind, and spirit moving like this, I'd say that the spirit part is the number one thing that we leave out. I mean, I know you guys focus on it, but across the board, spirit, mind is there. And then the body is the thing everybody focuses on, but it's the thing that comes along for the ride. So just, you're that powerful. Yeah, and I think that's the scary part. We are that powerful. And all the healing, I've pulled conventional doctors because I just want to make sure I have cool stories to share. I asked over 100 different doctors, and I said that were conventional, not functional, they don't know about mast cell activation or anything like that. They're like, when you give someone an antibiotic for the treatment of bacterial pneumonia, does the antibiotic sterilize their infection? There have been exactly that many, 0 doctors who have said, yes, the antibiotic does all the work. I said, so what happens? They say, well, the antibiotic brings down the level of the infection until the immune system has time enough to recover and then take care of the rest of it on its own. I'm like, you know how the body works. Why don't you treat everyone with that knowledge? But that's how it works. So I think that's inspirational. And that's how I got better.
I must admit, I draw a lot of inspiration from the people that we see, because how hard they work to get back their health is just like when I can say goodbye. I mean, my goal is always to say goodbye to someone and hope that they have a toolkit that's going to see them through. And by the time that happens, I'm usually in awe of them in a lot of ways. It's just amazing.
So powerful.
What people can do.
You know, Alex, I mean, I'm glad you bring it up, because it's like, you know, one of the things we were talking about ahead of this is like, you know, what do I have patient stories that really stand out as people that like, who are really stuck and really found their way? And when you guys sent that question over, I was like, the timing could not be any better. 2 weeks ago, I graduated 3 people in like 2 days. I had a lady who came to me on Biaxin, which is an antibiotic. She swore her breathing was terrible, never be able to get off of it. Had seen other docs for over 10 years, worked with her for 3 years. She's like, doc, I don't even understand this. I don't need to come back. I am 100%. I'm like, and she's in her mid 70s. And she's been sick for almost 13, 14 years now, if not longer, and completely gone. But she came to me telling me, I just need you to prescribe my medicine for the rest of my life. I was like, I don't do that. If you need it, you need it, but let's get you better. And I had another person who's seen by some other doctors for like 8 years, came in. She's been on these crazy protocols for like 3-4 years. And I finally said, look, your relapses just don't look like real relapses. Your meds stop it. But I think it's this. I think your lifestyle is way too stressful. Made a big job change. It was super scary. As soon as that happened, all the physical symptoms went completely away. It was a combination of the stress reduction and the mindset work along with the meds. But then now, for the first time in like 2.5 years, we've actually been off of medicine for over 6 months and 0 symptoms. And it wasn't that she didn't need the meds. It was she needed to do the meds and the mindset work and bring down the stress. And so she's like, I don't even know what to say. Like, I don't want to lose you, but I'm not. And then I can just keep going on and on about that. But it's like, it was that when I started with them, I ask everybody, are you willing to look at this from a different perspective, even if it's the same medicine or the same approach? Because a lot of times, like the Rubik's Cube analogy, we need to it's not just about knowing the right thing to do, but it's the right order to do it in for you. And a lot of what we see on social media or the support group is the right way to do it for somebody else. So we all have our own journey. And then it's like amazing, because it's like, it's like, take a step back, practice crawling, then walk, and then run, and then understand that like duration of therapy, whether it's Dr. Theorides talking about if he could give you 10 things for mast cell or one thing, he's like, give them one thing for a long period of time, let everything calm down. So take your time. A lot of this stuff is on the biggest problem. If we wrap back to the beginning, like, why do a lot of people miss this? They don't like the time frame. we're taught like modern medicine is really good for the 72 hours before and after a problem. And that's about it, unless like certain cancers we're getting a little better at. But for the most part, we need time we need to work with a team. And I really think people need to sit in front of the mirror and say, I love you. And it's like literally the best therapy in the world. And if it's hard, reach out to amazing people like you guys to get, or myself, because I should put myself in there too, but we can help you. There's a lot of ways to help, but man, you got to go for it.
You guys can find Dr. Tom Moorcroft at originsofhealth.com. Thank you for being here with us today.
Thanks for having me. It's such an honor.
Yeah. Alex and Kimberly.
So good to see you again.
Yeah, it's great to see you. It's been too long in person, for sure.
Yeah, and I just love the conversation around all the different layers of the journey. There's so many layers of healing that can happen if you allow it. And some just want one layer. And yeah, it's that deep dive into all the layers to get back to fully health. Yeah.
And if anybody's interested, next month is Lyme Awareness Month. I typically do the thing. If you're interested in the nuts and bolts of Lyme and how to prevent it and where it comes from and all the other stuff that we didn't have the time to dive into, I did a 4-part or 5-part series last year. It's all up on our YouTube, which is just Origins of Health as well. But this year we're doing something completely radically different. This part that we ended on is all I'm talking about. There's no diagnosis, there's no treatment. That's already up there. It's changed almost none because we haven't had breakthroughs. We're really going to be focused on physical, fascial healing. We're bioenergetics, mindset, heart set, and just really ultimately bringing it together through May, talking about how I actually healed. And I know that the people who heal in my practice are the ones that follow the path that we've been talking about, and they're open to all of these things. You guys are so worth it. You're so amazing. And it's like, I just want everyone the world's kind of like a crazy place right now. So we need there's a lot of light, but it's not being shined as much as we could. So I want everyone to touch it base with their passions, shine their light, because you're going to influence. Jamie, I always see somebody walking behind you every once in a while. The people around us, I learned from my daughter who's now 15, they might give you the bird to your face, but they're in the other room going like this. They are paying attention and they're listening too. So if other people are sick around you, the best way to help them get better is to lead by example. If you're sick and somebody else in your family is sick, focus on you and bring them along. Don't demand they do something you're not doing. But together, if we shine our light, the world's needed it more than ever. And by shining your passion, you improve your immune system and you get better too. Yeah, so it's like a win-win-win.
I have a 6-year-old too, and I'm really passionate about moms doing the nervous system work because we co-regulate with our children. And what you said about spreading the love and sharing the love, I use magnesium lotion on my son, and when he rubs it on his belly, we say, I love my body. I take care of my body because my body takes care of me. And so for any moms listening out there, need something to pass along, share that love. I think it's a great message to end on, that, I say it all the time, you have to feel worthy of health.
Yeah. And how many people take a handful of pills and they're pissed off about it? Why don't we turn that into a healing ritual and say how much I love my body and my soul, and that's why I'm taking it? Make it a gratitude practice and a healing experience.
We say at least one thing we're grateful for every night at dinner. That's another practice I've incorporated to bring this awareness to at a very young age. I think that's the importance, is our generation, that was not a focus. Our parents were not focused on being nurturing because their parents weren't focused on being nurturing. So we have that power to change that and pass it on to the next generation. Even telling our food we love it, our water we love it. There's studies on the structure of water. Yeah.
Mm-hmm.
Spread the love.
Each and every time.
Well, thank you so much, Dr. Tom, for being here with us today. Yeah.
Thanks for having me. So grateful to be here.
It's great.
Yeah.
So appreciative.
We will see you guys next week. Thanks for being here.